Nurse Amy from www.doomandbloom.net, and I'm here today to talk to you about one of our newest products. But mostly I'm here to just help you become more medically prepared. So if you'd like to make your own bag, feel free to use these contents because I think this is a wonderful bag. This is what we call our medium trauma bag. Now this only weighs about 5 pounds. It has a carrying handle, and we'll open it up in a minute. But the back has your MOLLE so you can attach it that way. We also have a handy dandy shoulder strap. So this is a fantastic kit, very lightweight, easy to move around when you need to bug out quickly. But let's open this up. It has a little clip right here, and you're just going to release that. You're going to pull back the cover, and this actually unfolds. So you have 3 sections, and I want to show those to you. You have a bigger section here, and you have 2 smaller ones, but they're not really too small. So, what do we have in this bag? First of all, the most important thing is easy access to gloves. We have 10 nitrile gloves here, along with your hand sanitizer. Throw this on your hands quickly and go ahead and put your gloves on. Really important, you always want to put gloves on before you touch a patient. So, that's your most accessible item. Then we have your wound care. You have lots and lots of antiseptics, but one of the most important things I want to talk to you about, we're having a thunderstorm, excuse me, is raw honey. Now raw honey is wonderful for wounds, for burns, for lacerations. It's also an oral antibiotic. And if somebody has low blood sugar, this is what you want to give them. It's also wonderful for flavoring teas. So don't forget your raw honey. We also have included in here, for 2nd-degree burns, some burn gel with lidocaine. Now this is going to help not only healing, but it's going to help prevent that terrible pain that people get with burns. We have included a silver cream and also a triple antibiotic ointment. Now, like I said, you can use these interchangeably, the triple antibiotic ointment and the raw honey, so don't forget that. You have alternatives. We also have in here sting relief. These also have some numbing medication and wonderful for your bug bites. So, the next thing we have are BZK wipes. Now BZK wipes are great not only for your hands to clean before you put those gloves on, but they can be used to clean wounds without being cytotoxic. Now a lot of people discuss betadine. Straight betadine should only be used the very first time you clean a wound. After that, just use antiseptic ointments. So BZK wipes are great. You do have lots and lots of betadine. Now a wonderful thing about these wipes is you can place 1 or 2 of these in your potable or drinkable water and make an antiseptic solution. What you're going to do with that solution, you're going to take your 60cc syringe, you're going to fill up some water, drop 1 or 2 of these in the water, you're going to pull this up, and then you're going to use this for wound irrigation, like that. You want a nice strong jet of water, that's really important. But we will do a wound closure, or wound cleaning video soon, I promise. You also have, of course, your alcohol wipes. Now the alcohol wipes I would primarily use for cleaning your instruments, which we have in here, and I will show you in a minute. Those are not necessarily good for a wound. Again, they can have some cytotoxic effects. They may inhibit the newly growing cells within the wound, so you want to kind of keep those out. We also have 2 ice packs. One is an instant ice pack. We also have a reusable, and it can be heated. Why are we having a storm? We need the rain, so that's good. This is your bleeding pack. It's in the middle section, easy to grab. I have repacked an additional 10 gloves in this kit. So if somebody's bleeding, you can grab this, slap your gloves on, grab your non-sterile gauze, put that in the wound, and hold pressure. 80 to 90% of bleeding is going to stop with pressure, so this is going to be your key. You also have a pressure bandage. Once you have stopped the bleeding, You can go ahead and put a brush or bandage on, and it will maintain the pressure so you won't start bleeding again. We also have hemostatics. We have 2 sea locks. We also have natural organic cayenne pepper. And there are some instructions here about what to do. But cayenne pepper is good if it's 35,000 HU or Scoville units or higher. If it's less than that, you don't really get that good hemostatic effect. If it gets much higher than that, if you breathe this in while you're pouring it in the wound, you're not going to be able to see or breathe because you're going to be choking and your eyes are going to tear. Trust me, I have packed higher Scoville units and it was very difficult to breathe afterwards. And of course you have your tourniquet in case you need it. So that's your little wound care kit. Excuse me, bleeding. Now you have all your instruments. You have a pair of real scissors. These are stainless steel. These are heavy duty. These are not going to break when you got to cut the jeans off of the person who has a fracture or a wound you need to see. You also have 2 tapes. You have your adhesive tape. You also have a duct tape. A million different uses for duct tape. You should always have that in your medical kits. We have for wound closure, of course, just Band-Aids. We have 100 different Band-Aids in here, different sizes. And we include 2 packs of steri strips. Always use your least invasive method to close a wound. Boy, the gods are speaking to us here. Thunder. We also have 2 sutures. Now these are number 2 or 2O nylon sutures, and they're packed sterilely. So those are with your Band-Aids. And we have more thunder. We have an instrument pack. Now within this instrument pack, you will have your pen light, your tweezers, your iris scissors, and also a hemostat, so you can do that suturing. We have 5 tongue depressors, a thermometer, and a pen light. So that's all included in the little instrument kit. We also have another method of wound closure, which is super glue. So you have butterflies, which you can make out of your duct tape, you have steri strips, you have Band-Aids, you have sutures, and you have moleskin. Now, this is something that you want to use in a donut shape. The inside is going to be where the blister is, and the circle around it is going to cover the outside of the blister to create some padding. Okay, this is our gauze pack. We have in our gauze pack, which is in the back section, a Chuck's pad to lay out in case you're in an austere environment and it's kind of dirty and you want to lay out all of this stuff. You have a blood stopper. This includes a 5x9 pad inside here, and also 2 roller bandages. One of them is loose, you can use that to stop bleeding, and the second one is attached to the pad and it will help hold on the wound to your arm. We have 4 ABD pads or combines. We have 20 sterile gauze or 4x4s. These are packed to a sterile pack, so you have 10 of these. We have lots and lots of sterile gauze. Our pile's getting big here. We have 5 of the Telfa pads. Now these are wonderful for burns because they don't stick. They're also called non-adherent or non-stick. This is what you're going to finally dress the burn after you've cleaned it and cooled it off. And you may want to use a roller bandage to keep this on, or I have a couple other methods to hold these on, or you can even use the tape. We also have 2x2s, you have 5 of those, and you have 4 iPads. Not the actual iPad, but an iPad. In the back, we also have Gold Bond powder. We have 40 Ibuprofen tablets. And we have something called Coban. Now, I discussed this in Survival Medicine Gauze, in our different gauze, but this sticks to itself. So what you can do is when you put the sterile gauze on, you can use this, wrap it around a couple of times, and then cut it, and it's actually going to stick to itself instead of the patient, so that when you remove it, you're not removing skin or hair around the wound. So that's a very handy thing to have. And then included in this pack, we also have 2 solar blankets. Hypothermia also helps if somebody's going into shock. You want to keep that patient nice and warm. Our final pack is 2 triangular bandages. Great for a lot of different things, including slings and tourniquets. Also helps to hold on makeshift splint material if you need to. Sticks or wood, these will hold it on so your fracture is held in place and can heal. We have 2 large ACE bandages, great for sprains and strains. Now I talked about the Curl-X roller bandage, and we do have 2 of those in here. And these are in sterile packages. Again, great for either grabbing up into a ball, putting into the wound, thunder, help to stop bleeding. And we have 2 surgical masks. If you need to protect yourself, these are wonderful. If you have somebody who's sick and coughing, you want to put this on the patient because it will hold the viral droplets that they're coughing and sneezing and keep from sneezing on you. And this is our entire bag. Again, this folds up into a nice little pack. It has the clip. It's very lightweight. This is our medium trauma bag. Please visit us at www.doomandbloom.net. We have a store in the pretty blue tab. This is Nurse Amy. We also have 250 medical articles for your free preparedness information. We also talk about organic gardening and lots of natural remedies, because when the pharmaceuticals run out, you need to check nature. So, take care, thanks again, and we'll see you soon. Bye-bye.